So of course we are very well aware of the quarantine of the Ritsona camp, and our assessment is that it's a well-managed camp and they have access to healthcare. So as Commissioner Johansson said, I think they can manage, but it's nonetheless a very strong warning signal. Now, it's of course the Greek authorities that are responsible for public health in Greece, but the Commission is providing massive support. And in particular, we've agreed now with the Greek authorities an emergency response action plan, which has a lot of very relevant elements, in particular in terms of identifying the people who are most vulnerable in this context, quarantining new arrivals, and the need to start moving the vulnerable people out of the camps as rapidly as possible. And it's now essential that this plan is fully and rapidly implemented. And in this respect, the Commission is again very much ready to provide continued support. The Commission's efforts to relocate unaccompanied minors together in cooperation with Member States, and of course with Member States pledging places, as well as the initiative we announced on voluntary returns from the Greek islands also need to be seen in this context and are very relevant. And then for specific, your specific question about the types of support, again, as you know, the Commission has been very active in providing support to Greece in terms of migration management, over 2.4 billion euro provided since 2015, and now an additional 700 million euro, which will be available to Greece. So lots of elements mentioned in the LIBE committee about what exactly these funds will be spent on. But a lot of the vast majority of these funds would be very much relevant in these circumstances in terms of increasing reception capacity, increasing also capacity on the mainland and on the islands, and deploying additional experts. And in addition to that, in addition to specific support for migration management, there is also the emergency support instrument activation proposal, which was explained here from the press room yesterday in a lot of detail, and which could also benefit the Greek health system in general. So lots of elements and a very, very active and urgent work from both the Commission and the Greek authorities on this front.
Thank you, Adalbert.